Vice President of Nigeria, Kashim Shettima, has urged the Nigerian Medical Association (NMA) to prioritize implementing policies that address gaps in the nation's healthcare system. Speaking at the third National Health Summit in Abuja, he stressed the need for actionable solutions to serve under-resourced communities and vulnerable citizens. Represented by Coordinating Minister of Health, Professor Ali Pate, the Vice President stressed that healthcare policies often remain on paper, hindered by challenges like poor doctor-patient relations and implementation failures. Professor Pate called for sweeping reforms to ensure access to affordable and quality healthcare nationwide, aligning with the administration's focus on breaking barriers of cost, infrastructure, and workforce challenges.
I'm saying that Nigeria's healthcare system, like most healthcare systems, has positive elements, but also the not so good elements. There's a gap in performance between where we are and where we ought to be. And if you look at the underlying reasons for that performance gap, it's financing, which has been inadequate for a very long time, inefficient in terms of mobilization, with huge issues of financial protection in many of our population, and that's reflected in the public perception survey. That's why in this administration, under the leadership of President Bola Ahmed Tinubu, we articulated the health sector strategic blueprint that focuses on saving lives, reducing physical and financial pain, producing health, because we know the burden of non-communicable diseases, hypertension, diabetes, cancers, but also to do it for all Nigerians. That's the universal health coverage aspiration, so that we're also equitable in how we address those issues. Our focus on just simple things in a complex sector that has multiple challenges, but also several opportunities. To expanding access to health insurance with the NHI has already made progress together with the states, because we all have to work in partnership with the states. On the human resources issues, I'm trying to share with you sort of the tangible thing, because we've said from policy, the problems, to actions, because that's the execution.
Adding his voice, NMA President Professor Bala Awudu lamented Nigeria's over-reliance on foreign drugs, which he said undermines equitable health delivery. He proposed achieving 70% self-reliance in medical production to build a resilient healthcare ecosystem for all Nigerians.
Us to harness the best brains in our health manpower so that we can put heads together to create that quality healthcare that is funded to the capacity that all Nigerians receive quality, patient-centered, respectable care without financial difficulties.
Dr. Ibrahim Abdul of the NDLA further reviewed the agency's efforts to reform healthcare by advocating for a global review of cannabis policies, urging professional bodies to support this discourse.
There is a narrative going on all over the world that there should be decriminalization of cannabis sativa. In the 1961 Singles Convention, this drug happened to be in one of the laws in the 6th schedule. It has now been wiped by the United Nations, which is a gradual way of making sure that they sell to the whole world this narrative of decriminalizing drugs. And the kind of cannabis that we have here, it has tetrahydrocannabinol, the most addictive substance in it, which is about 5%. And the one that they are advocating in their own Western countries is having only 0.02%.
As the summit continues, participants agree that tackling Nigeria's healthcare challenges requires collaboration, innovation, and a united effort to transform the system into one that serves every Nigerian, irrespective of financial or geographical barriers. Vincent Okushi, QTV News, Nigeria.